let's stop all that. We got insurance. If you don't got insurance, get you some county care, get you some Medicaid. Somebody gonna pay for it. The thing is, they're not gonna put you out the hospital. Hello Instagram, hello YouTube, hello Chicago, hello world. This is yet another casual conversation with me, Nyla Malone, your HydeParkTherapist. I am here with Dr. Chloe Haney. She is one of the most dynamic young women that I know. I'm gonna let her tell you about all of the great things she's doing in the community, where she works, where you can come and get treatment from her, and then we're going to get into the program today. Go on, Doctor.
Hi, my name is Chloe Haney. I am a family nurse practitioner, so I have a doctorate of nursing practice, so I'm like a doctor nurse. I pretty much do the same thing as any physician would do in primary care, family medicine. I have my own clinic out of Norwegian American Hospital. I do everything, pap smears, preventative screening, diagnose of actual diseases. I can prescribe medications. All of your healthcare needs, I can do it. I'm right out of Norwegian American Hospital. It's in Humboldt Park right here in Chicago.
Oh my gosh, she's beautiful and talented. Dr. Nurse, I love it. I am so proud of her. I mean, I wish we was some kin, but since we not kin, we can just still collaborate.
Hey, look.
We can pretend like we can. This is my niece, y'all.
Right.
This is my niece, and I adore her. She's a beautiful person inside and out. And we brought her here to talk about something that's important to all of us, and it's preventative screenings. I know black folk, we scared to go to the doctor sometime. Maybe be like, oh, I cut myself, let me put some duct tape on it, all that. Let's stop all that. We got insurance. If you don't got insurance, get you some county care, get you some Medicaid. Somebody gonna pay for it. The thing is, they're not gonna put you out the hospital. And these things, these preventative services and tests that Chloe's gonna talk about, is something that everybody needs to do so that we can stay healthy and maintain our health. So I'm gonna turn it over to our Dr. Nurse, and she's gonna tell us a little bit about probably breast cancer, colonoscopy, and prostate exam. So we're gonna start
smears,
with
girl. That's the woman, not the man.
Pap smears. Okay, pap smears. I'm sorry. It's a casual conversation.
Right.
Casual.
Okay.
So, we're gonna start with breast exam.
Yeah, let's start with basically what is a preventative test in the first place. So a preventative exam means that we are going to do a screening before you have symptoms. This is before you feel sick. And I think a lot of times we as African Americans or as individuals, period, we only go to the doctor when we feel sick. You wait until something hurts, until you're coughing, until you're about to die, and then you go to the ER. But you need to have a primary care provider to establish a relationship so that they know what you look like when you're healthy, so that when you're sick, we have something to compare that to.
Yes.
Okay? So I want to see you when you're healthy, when you're laughing, when you can kiki in the office. So then when you're sick, I'm like, wait a minute, I can look at you and know that something is wrong right away.
Okay.
Right? So a preventative screening is an actual test that we do while you're feeling healthy. Okay? So before you have symptoms, we can detect diseases. Okay? So like HydeParkTherapist said here, we're going to talk about pap smears, colonoscopies, and mammograms. So the first thing we're going to talk about are mammograms. So we just got out of Breast Cancer Awareness Month right there in October. So a mammogram basically is almost like an x-ray of the actual breast, right? And we are looking for any cancerous cells or cancerous tumors in the breast before you actually feel them, okay? Now some people come in and they're like, I don't need to do a mammogram. I do my self-breast exams all the time and I don't feel anything. However, a mammogram is going to detect tumors before you actually feel something, okay? By the time you feel a lump or you have skin dimpling, typically it's too late, all right? So I'm going to show you some pictures of the different stages of breast cancer so you can kind of have an idea of what we're looking for when we do the mammogram.
I got one question. How old should you be before you get your first mammogram?
So that varies, and it really depends on what governing body you talk to. The consensus is typically around age 40, but there's another governing body that says, and the governing body, they make our guidelines. They're who we follow. They're the people who've done the research. So one governing body says at age 40, another one says age 50. So I typically start at age 40 every 2 years, and then by 50 we'll start to do it every 1 year. Okay.
So if you have cancer in your family, if that's something that happens, should you have it happen more?
Yes. So let's say if you have a family member who was diagnosed with breast cancer at age 40, I'd say start to come in at 35. So 5 years before, let's say, your mother was diagnosed, I would come in and start doing those screenings. And that's something that you can talk to your primary care provider, and you guys can make that decision together on when you should start your screenings.
Okay, good. I'm glad you said that. Take care of your boobies. Let's go on, do your thing. Guys.
Okay, all right. Alright, so here you can see this is a stage 1 breast cancer. This is the breast. This is the normal tissue of the breast. These are the lymph nodes, and this here is an actual tumor, okay? And though you can see the tumor really well on this picture, you cannot feel this tumor yet. So if you were to do your self breast exams at home, you're not going to feel this tumor just yet, okay? This is when we want you to come in and do your mammogram. This is when we would prefer us to detect the cancer, because at this stage we can do a quick surgery. You might not have a total mastectomy at all, and we can get rid of that cancer, okay? At here you can see we're at stage 2. The tumor has grown, but it hasn't spread anywhere, okay? We've just got the tumor, and we can detect it here, and there's still a chance that you're going to have a high survival rate here, okay? This is stage 3. We can see here the tumor has grown, and now it's starting to spread into the lymph nodes, okay? This is a stage 3 breast cancer. This is going to be a lot more involved in terms of care. At this point, you're going to have a total mastectomy, which means removal of the entire breast. They're going to have to remove some of those lymph nodes, and because it's spread, more than likely you're going to have to undergo chemo and or radiation, okay? This is stage 4. This is when we don't want to detect it. At this point, you may start to have some symptoms, and we don't want you to come in when you're already having symptoms. As you can see here, the tumor has started to grow. It's not only spread to the lymph nodes, but you can see here it's spread to the surrounding organs, which typically, when it comes to breast cancer, it's the lungs. So you're going to have a total mastectomy, a radical mastectomy, which means they're going to remove breast tissue, they're going to remove lymph nodes, and then afterwards it's pretty deformed, okay? It's going to be a very deformed breast after, and then you're going to have to do chemo and radiation to target the lungs, and the survival rate at stage 4 is going to be significantly decreased. So the purpose of these mammograms is so that we can detect this cancer right here at stage 1 before you have any symptoms, before there's any real problems, and your survival rate is going to increase significantly.